So we confronted with a 58-year-old man patient presented with an exertional dyspnea, NIHA class 2, and managed exercise intolerance. He noticed recent swelling in his ankles and chest tightness when he sleeps on one pillow during the night. He has past medical history of myocardial infarction 5 years ago, history of heart failure, hypertension, dyslipidemia 5 years ago, and diabetes 10 years ago. He has a past surgical history of total left hip arthroplasty 11 months ago. His family history was remarkable for his father, who had a type 2 diabetes and morbid obesity along with end-stage renal disease. He's working as an accountant. He's married with 2 healthy children. He's ex-smoker. He doesn't drink alcohol, no drug abuse, and he does not exercise regularly. He uses a potassium-based salt substitute for his diet. His physical examination was remarkable for his BMI was 29, elevated jugular venous pulse, 6 centimeters above the sternal angle, faint S3 with apical systolic murmur, and his extremities showed a pedal edema bilaterally. This was his EKG, and I'd like to have your inputs. What does this ECG reveal? Is it anterior myocardial infarction, inferior myocardial infarction, LVH with a strain pattern, left bundle branch block, or right bundle branch block? Any inputs? Yes.
دكتور ممكن كلنا نفتح اللايف بول وندخل السيشن بين اللي هو 5078. ندخل السيشن بين الاول عشان نبدا اللايف بول.
في سؤال في الأول مش موجود. أول سؤال مش شغال. So this is not active in the voting system, this question. So what do you think? Is it the left bundle, anterior myocardial infarction, LVH with strain pattern? So it's a left bundle branch block. His ECG, his echo showed reduced ejection fraction, reduced global LV systolic function. Ejection fraction was 35 with marked akinesis in the apical segments and interventricular septum. His metabolic panel was remarkable for elevated creatinine 1.3, fasting blood glucose 196, and elevated hemoglobin A1C 9.2, along with hyperkalemia 5.6. So his diagnosis was congestive heart failure with reduced ejection fraction, ischemic heart disease, anterior myocardial infarction, type 2 diabetes, dyslipidemia, left hip arthroplasty. His current medication were enalapril 10 mg oral twice daily, carvedilol 6.25 mg twice daily, aspirin 81 mg, spironolactone 25 mg, furosemide 40 mg, atorvastatin 40 mg, pioglitazone 30 milligram, glibenclamide 5 milligram along with metformin 800 milligram, and naproxen over the counter for left hip arthroplasty.